The year 1928 marked a pivotal moment in the annals of medical history, forever changing the course of human health. It was then that Alexander Fleming, a Scottish bacteriologist, made an accidental yet profound discovery: penicillin. This breakthrough ushered in the age of antibiotics, a revolution that would fundamentally transform the treatment of bacterial infections worldwide. Before penicillin, the world faced a grim reality where even minor infections could prove fatal. Simple cuts, common illnesses, and surgical complications often led to agonizing deaths. Mortality rates were alarmingly high, with diseases like pneumonia, sepsis, and wound infections claiming countless lives. The pre-antibiotic era was characterized by a constant struggle against unseen microbial adversaries. Doctors and patients alike lived with the ever-present threat of bacterial onslaught, often with little more than hope and rudimentary treatments to offer. Penicillin promised a new dawn, a powerful weapon against these microscopic killers. Alexander Fleming's groundbreaking observation occurred almost by chance in his London laboratory. He noticed a peculiar mold, later identified as Penicillium notatum, contaminating a petri dish of Staphylococcus bacteria. Around the mold, a clear halo indicated that bacterial growth was inhibited. This serendipitous finding laid the foundational stone for what would become a global turning point in healthcare. Fleming's initial findings were undeniably groundbreaking, yet their full significance was not immediately recognized or appreciated by the wider scientific community. He had stumbled upon a natural antibacterial agent. Fleming meticulously observed the antibacterial properties of this mold, documenting its ability to destroy various harmful bacteria. He understood the potential implications of his discovery, but faced significant challenges in harnessing its power. The scientific tools and resources of the time were limited. Crucially, Fleming lacked the expertise and the necessary infrastructure to isolate and purify the active compound from the mold. He struggled to produce a stable and concentrated form of penicillin that could be effectively used as a therapeutic agent. His efforts to stabilize the compound proved largely unsuccessful. Despite these limitations, Fleming published his findings in 1929 in the British Journal of Experimental Pathology. However, his work, though significant, was largely overlooked by the medical establishment for several years following its publication. The world was not yet ready to grasp the magnitude of his accidental genius. The challenges of purification and mass production meant that penicillin remained a laboratory curiosity rather than a life-saving medicine. Fleming's initial work, while visionary, represented only the first step in a much longer and more complex journey. The true potential of his discovery awaited further development. The true significance of Fleming's discovery would not be fully realized until more than a decade later, spurred by the dire circumstances of global conflict. The urgency of the Second World War created an unprecedented need for effective antibacterial agents to treat wounded soldiers. Infections were rampant and devastating. In 1939, a team of scientists at the University of Oxford revisited Fleming's largely forgotten research. This pivotal group was led by Howard Florey, a pathologist, and Ernst Chain, a biochemist. They recognized the immense potential of penicillin in the face of wartime casualties. Florey and Chain embarked on a rigorous scientific endeavor to overcome the obstacles that had stymied Fleming. Their dedicated research focused on the complex processes of isolating and purifying penicillin from the mold. This was a painstaking and challenging task, requiring innovative biochemical techniques. Their efforts proved successful, leading to the first stable and usable forms of the antibiotic. Beyond purification, the Oxford team also pioneered methods for the mass production of penicillin, a critical step for its widespread application. This involved scaling up laboratory processes to industrial levels. The team then demonstrated penicillin's remarkable efficacy in treating bacterial infections through a series of groundbreaking clinical trials. These trials, initially conducted on mice and then on human patients, unequivocally showed penicillin's power to cure previously untreatable conditions. the results were nothing short of miraculous. The success of Florey and Chain's work transformed penicillin from a scientific curiosity into a life-saving drug. Their dedication and ingenuity, combined with the pressing needs of wartime, propelled penicillin into the forefront of medical treatment. This collaborative effort brought Fleming's initial observation to fruition. The British government, recognizing the strategic importance of penicillin, initiated efforts to scale up production. However, the sheer volume needed for the war effort necessitated international collaboration. This led to a crucial partnership with American pharmaceutical companies, accelerating mass production. This wartime collaboration ensured that penicillin became available to Allied forces, dramatically reducing mortality rates from battlefield injuries and infections. The drug's impact on military medicine was immediate and profound, saving countless lives and changing the face of wartime healthcare. The introduction of penicillin had an immediate and profound impact on global health, particularly during World War II. It saved countless lives by drastically reducing mortality rates among soldiers suffering from infected wounds and diseases. The drug became known as the miracle drug for good reason. Beyond the battlefield, penicillin's success spurred further intensive research into other antibiotics. This led to the rapid development of a wide arsenal of antibacterial drugs, each targeting different types of infections. The age of modern pharmacology had truly begun. Penicillin revolutionized surgical procedures, making them significantly safer and allowing for more complex operations. The risk of post-operative infection, once a major deterrent, was dramatically reduced. Surgeons could now undertake procedures previously deemed too dangerous. The drug also significantly improved the treatment of common infections that had long plagued humanity. Diseases like pneumonia, strep throat, syphilis, and gonorrhea, once deadly or debilitating, became treatable with a simple course of antibiotics. This transformed public health outcomes. The widespread availability of penicillin marked a turning point in the fight against infectious diseases. It offered hope where there had been despair, and effective treatment where there had been none. The medical landscape was irrevocably altered for the better. This single discovery laid the groundwork for modern medicine's ability to combat bacterial pathogens. It demonstrated the immense power of scientific research and collaboration in addressing global health challenges. The world had gained a powerful new tool against disease. The discovery and widespread use of penicillin extended lifespans and dramatically improved overall public health across the globe. It fundamentally changed the practice of medicine, shifting the focus from managing symptoms to actively curing bacterial infections. The quality of life for millions improved. However, the very success of penicillin also highlighted a critical long-term challenge: the potential for antibiotic resistance. The overuse and misuse of these powerful drugs inadvertently led to the emergence of resistant bacteria. This phenomenon posed a new and complex threat to global health. Bacteria, through natural selection, evolved mechanisms to evade the effects of antibiotics, rendering some treatments ineffective. This ongoing battle against resistant strains continues to this day, demanding constant vigilance and the development of new antimicrobial agents. The initial miracle drug now presented a new dilemma. Despite this challenge, the discovery of penicillin remains a testament to scientific curiosity, perseverance, and the collaborative spirit of research. It stands as one of the most significant medical breakthroughs in human history, demonstrating the profound impact of scientific inquiry. Penicillin's transformative impact on human health is undeniable, having saved hundreds of millions of lives since its widespread adoption. It forever changed the course of medical history, ushering in an era where many once fatal infections became curable. The world became a healthier place. The legacy of penicillin extends far beyond its immediate therapeutic benefits. It paved the way for a healthier future, inspiring generations of scientists to pursue new treatments and cures for a myriad of diseases. It underscored the importance of medical innovation. The story of penicillin serves as a powerful reminder of both the triumphs and the ongoing challenges in medicine. It highlights the delicate balance between scientific progress and responsible stewardship of life-saving discoveries. The fight against infectious diseases continues, shaped by this initial breakthrough. From a chance observation in a London lab to a global life-saving medicine, penicillin's journey is a compelling narrative of scientific endeavor. It underscores how a single discovery can ripple through society, transforming lives and shaping the destiny of nations.